Jackie, thanks so much for joining me today.
Of course, thanks for having me.
So, Jackie is one of our therapists, and actually, Jackie, you've been with us so long. You started with us as an intern, which is amazing, and now you're getting your PhD and you're working specifically at this time in treatment facility for people with eating disorders. Is that right?
Yeah, so I'm in a PsyD program, which is Doctor of Psychology. And yeah, that's okay. And my externship, my training facility this year is on an inpatient unit for eating disorders at a hospital.
Yeah, right. So that's really intense. Most of
Mhm.
our audience and the people that we work with at Expansive, I mean, I think so many people struggle with some sort of nourishment feeding themselves issue, food, body image, like all of that.
Mhm.
So we'll keep most of our conversation to sort of a little bit more of a general population, but I love that you're getting that specialty because so many people, yeah, come in with with a lot of suffering in that area.
Absolutely, yeah.
So yeah, so I just thought maybe we could just start out like to discuss the difference between an eating disorder and what we call disordered eating. Well, how do you see that?
Yeah, yeah. And I want to sort of preface everything that we talk about today just from the standpoint that I am a trainee. So I'm speaking from what I've learned in my experience thus far, but by no means am an expert in this field. But yeah, no, disordered eating, to your point, is so prevalent in society. And in just, I feel like we see it everywhere. It's so embedded into regular everyday conversations. But the major difference is between disordered eating and an eating disorder is when it starts to impact our functionality.
Right.
So if it's influencing, your social world, like maybe you're avoiding a social gathering because you're afraid or nervous or uncomfortable around the eating piece of it, right? Or maybe it's impacting you mentally or emotionally, like you're noticing changes in your ability to concentrate, you're noticing changes in your ability to regulate your emotions. So essentially, yes, when it impacts your functionality is when it gets into the disorder territory.
Right. That makes so much sense. And then disordered eating can be anything from like just maybe too much thinking about food, maybe over awareness, monitoring, kind of measuring. I don't know, what are some of the other things that people do?
Yeah, I mean, I think it's also behaviorally speaking, like maybe an avoidance of food, which doesn't necessarily need to connect to body image. But there are diagnoses like RFID, for example, which stands for Avoidant Restrictive Food Intake Disorder.
Mhm.
And that can sometimes come from like a phobia. So, for example, if somebody had a really terrifying choking experience, they might not want to put food in their mouth for fear of perpetuating that sensation.
Yeah, that's like a whole other category that I haven't really come across, so I don't
Mhm.
think about that too much. Most of the
Mhm.
time when I'm thinking about disordered eating and eating issues, it's
Mhm.
around body image. And,
Right.
I think our culture is so difficult. We're not getting away from it. So we have to figure out how to live with all the messages that we get and how to have kind of a good relationship with ourselves and our
Mhm.
ability to nourish ourselves lovingly, right?
Absolutely. Yeah.
Yeah.
Right.
I wonder, I don't know, do you think there are any sort of major misconceptions about eating disorders?
I mean, I actually think to exactly what you said, your point is maybe one of them is that eating disorders are only about body image and size, although they are very kind of classically and really, really commonly about that.
Yeah.
Um, but I'll take this moment to highlight that within sort of the eating disorder world that I've seen so far, there is kind of this, it's called the HAES model, HAES. It stands for health at every size. And so that is kind of it's kind of like an acknowledgement that eating disorders can a lot of the time revolve around body image and size and paying attention to that.
Mhm.
And it's also about so many other things
Yeah.
outside of that sphere as well.
Yeah.
Yeah, and there's kind of this kind of classic saying about how eating disorders are all about food and also not at all about food,
Right.
right? Which I think is really interesting.
Yeah. I mean, coming from a ballet background,
Hmm.
I knew people with eating disorders, and I count myself as super lucky not to have gotten one because, you're growing up in front of the mirror and you're constantly judging your body and how it's moving and what it looks like. So I certainly have, awareness. I get grumpy when my pants are too tight, things like that.
Hmm.
So I can relate to a lot of it, and also kind of constantly work on the subtle ways I notice it in my life. I did notice one thing recently, Jackie, where this was such a big deal for me. I mean, as an older person, to notice, as a ballet dancer, you're always supposed to have a really like flat stomach, right?
Hmm.
I had a flat stomach, since I was 14 or something. But I was just noticing my stomach the other day and noticing how it felt so much more relaxed than it usually does. And I loved that feeling. It was kind of like, it was just like a soft, warm, like relaxed feeling,
Mhm.
which was really good. And made me notice, oh, I don't think I've always felt like that. Like the belly, there's a lot of feelings about the belly, right?
Yeah. That actually is another misconception about eating disorders right there is that sometimes these things that we feel like are going to be with us forever um are not always there forever, right? This idea that like I've paid so much attention to this and this has been with me my whole life. Who
Yeah.
am I without this like constant train of thought or this constant concern? But kind of connecting it back to what we were just talking about, eating disorders, you can recover from one and you can go and live life without being so preoccupied by a lot of these things that feel really weighing on you
Yeah.
on a day-to-day basis.
Yes, for sure. Let's talk a minute about like
Mhm.
how just somebody in your regular clinical practice, like not at the hospital, but somebody comes into the office and is working with you,
Mhm.
struggling maybe with some, restricting or maybe some binging. I know binging is quite common,
Mhm.
binge purge. Um, yeah, how do you begin to work with them?
Yeah, I mean, I think that's a really good question. And I think I would start with basically just trying to understand what their understanding is of what's going on with them. So
Hmm.
if they're coming in and kind of upfront saying, I'm really struggling with some sort of, disordered eating, disordered thoughts around eating, disordered thoughts around my body, just kind of really understanding if they know where that's coming from
Yeah.
and really just trying to get an understanding of exactly what those thoughts are, right? So is it a fear of actual physical discomfort? Because that's sometimes a presentation. Or is it a fear of like your body changing in any capacity? And sometimes, with the insight, it gets really interesting because sometimes you'll see that people they really truly believe that it's about one thing when as we dig a little deeper, it actually ends up being about
Yeah.
something else or a whole host of other things too.
Right, right, right. And expensive, we have a fair amount of trans clients and,
Hmm.
the body developing and changing, like that can actually feel quite traumatic if you don't feel aligned with it, right?
Yes, absolutely. Yeah.
I did work for a very long time with such a lovely client who struggled with binge purge
Hmm.
sort of cycle. What
Hmm.
actually made it really hard, and we spoke about it very openly as it was kind of her friend, right? It was a coping mechanism
Hmm.
that had been her friend for a long time. And what actually made it super hard was that she whittled it down to maybe like once a month or something.
Hmm.
So she felt as though it was manageable.
Mhm.
and therefore kind of okay.
Mhm.
And I struggled in the work with her, you know, I just struggled internally, like wanting her to have like a fuller healing experience. Yeah.
Mhm.
Yeah. So I think a lot of people think, well, I'm only doing it just like a little bit, or I only do it this, it's kind of like an alcoholic. Well, I'm only going to do it on the weekends, or I'm going to, but it's still internally this shame that we're carrying around, right?
Yes, yeah. Yeah, and I think a lot of, a huge characteristic of eating disorders is that there is just that sort of constant preoccupation
Mhm.
with thinking about these things, even if you're only engaging in these behaviors every so often, right? And so at that point, if we are working with a client who's kind of presenting in that way, maybe it's worth asking, like, okay, maybe you're only engaging in XYZ behavior, but how often are you thinking about it?
Yeah.
What are you thinking about on a day-to-day basis, right? Are you kind of waiting, that whole month for that day that you feel like you get to engage in that behavior?
Right. That makes me feel sad.
Yeah.
You know what? Let's touch in on the GLP drugs for a
Okay.
minute because
Mhm.
that's such a big thing right now. And
Mhm.
I do think that there are positive aspects to it for people. And I think that there's a lot of other stuff. So I'm just wondering what you think about them.
It's such a I think it's such a tricky topic. And I also think that, it's fairly, I mean, it's not a new medication, but in the sort of the trend, or not trend, but, the kind of like common usage for weight loss that's kind of really seemed to blow up in recent years.
Yeah.
And I think there's still a lot to be kind of learned about it.
Mhm.
However, I do think it is a really tricky thing because if somebody maybe starts a GLP-1 when when it's medically advised and there's a lot of medical benefits to starting the medication at a certain point, and this is actually something that sometimes we see in the hospital, is there reaches a certain point where it surpasses and no longer becomes medically beneficial. In fact, actually becomes medically detrimental. And people become pretty severely undernourished, malnourished. And it's really hard to see where that line exists because, first of all, it's different for every body and every person. But second of all, like, at one point it's medical advice, at another point it's against medical advice. It's just really hard to make that distinction.
Yes, and I would imagine that for people who have tended to be heavier and then they try this and then they're losing weight, the attachment to that
Mhm.
process, the attachment to being thinner. And again, we're dealing with body issues and how thin is healthy thin. And
Yeah,
then how do you maintain that? But I think it is kind of an incredible drug in that it works with the mind. And what I've heard people talk about is that, they used to be just constantly thinking about food,
right.
constantly thinking about food, and it relaxes
Mm.
that sort of obsessive thinking about food, which must feel like a miracle for a lot of people.
Yeah, right. The food chatter. I've also heard that like the food chatter really just declines.
Yes, exactly. Food chatter.
Mm.
Well, the last question that I have is, if anybody's watching that knows somebody who's struggling with some sort of an eating disorder or very disordered eating,
Mhm.
how can how can people support?
Mm. Also another really good question. In supporting like their peer or their friend, you mean?
Yeah,
Or
or like a family member. I mean, it could, there's a couple of situations. Well, there's a million, but one is that you really feel like somebody is struggling and they're not saying anything.
Mm-hmm. Right.
And then the other one is they've admitted to it, and how do you, like, let's say you're living with somebody that binges and purges, and
Mhm.
that I'm sort of getting into Al-Anon territory here, codependence. But like they struggle with certain foods, and like how do you support them, and how do you take care of yourself? And I'm
Mhm.
asking these questions, but I'm just thinking out loud, really.
Right, right. Yeah. And, I don't know if these questions exactly have a perfect answer because, I mean, I can also kind of think out loud with you, but that's such a hard situation to be in as someone who really cares for and loves someone precious and also is witnessing them struggle. And I think that's just a really hard situation to be in when someone's struggling with anything, really. But yeah, but when it comes to an eating disorder, I mean, I think so much of it does, I think there is a lot of, unfortunately, shame that surrounds eating disorders. And I think with anything that has a lot of shame attached to the behaviors and sort of the things that we're struggling with, it's really hard to confront. And it's really hard to have somebody come to you and ask you to confront it as well.
It's
Um,
it's so hard. And so I think that people can collude by
mhm,
not saying something. So Jackie, if I'm afraid that you have an eating disorder and I'm worried about you, one
mhm,
of the reasons that I might not want to say anything is because I don't want to upset you or I don't want to
right,
awaken the shame,
right,
right?
right.
So, but really, I think oftentimes these cases are really like love is sort of leaning in a little bit. And
Yeah.
not saying, like, listen, you got a problem, you got to fix it, but I'm here for you. It
Mhm.
seems as though you're struggling with this a little bit, right?
Yeah. Yes, I totally agree. I mean, I think, ultimately what the person chooses to do, whether to seek help or not, does fall on them. Um, and in supporting someone to try to get there as best as possible, yeah, I feel like leaning in with care and respect and love is maybe the best course of action as opposed to, yeah, accidentally and unintentionally colluding. Um, yeah, even though it might be unintentional.
Yeah, exactly.
Mhm.
Well, do you have any thoughts in wrapping up?
Um, I guess one of the last things I was thinking is just the idea that sometimes, it's very interesting. I think sometimes the idea of imposter syndrome is really common in presentations of eating disorders as well, where people might say, "Oh, well, I'm not XYZ body shape enough to constitute an eating disorder," or, "Well, I only engage in this so many days a week, so I'm not sick enough to have an eating disorder," or, my friend does this, so I don't have an eating disorder either. And so there is a lot of that kind of discounting and imposter syndrome when it comes to an eating disorder. And so I guess maybe one of the last things I wanted to share was that if you are noticing, or if anybody who's watching or listening to this is noticing that there are changes or things that they're seeing in terms of their behaviors or changes in the ways that they're feeling, functioning, anything like that, it is important just to kind of check in and maybe seek help. It doesn't have to be, going to an inpatient hospital, but maybe just bringing it up with a loved one, maybe just asking a couple questions. Yeah,
Yeah. Or, saying to their therapist, I think I just would like to take some time and explore my thoughts
exactly,
around it. Or,
exactly, exactly. Yeah.
wow, your therapist would love that.
Exactly.
All right. Thank you so much, Jackie. I really appreciate you taking the time.
Of course. Thanks so much for having me.